Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhal. Let's look at today's daily bulletin. Mumbai has seen a threefold rise in measles cases this year as compared to 2019. As per BMC data, 37 measles cases were reported in 2019, though the number was lower in 2020 and 2021. This year, however, the number has already touched 109. The civic body is trying to learn what led to the surge in cases. Meanwhile, the team deputed by the central government arrived in the city on Friday to investigate the outbreak. Uttarakhand Ayurveda and Unani Licensing Authority has asked Divya Pharmacy to stop the production of 5 medicines and produce their revised formulation sheets for approval. Divya Pharmacy manufactures Yoga Guru Ramdev's Patanjali products. According to the notice issued on Wednesday, BP Grit, Madhu Grit, Thyrogrit, Lipidome tablets and iGrit Gold tablets are being promoted as medicines for blood pressure, diabetes, goiter, glaucoma and high cholesterol. The notice says the company can restart manufacturing these products only after the authority approves their revised formulation sheets. The next exam, scheduled for December next year, will likely be conducted by the All Indian Institute of Medical Science, AIIMS, New Delhi. A decision on the matter is yet to be taken. NMC is going to release a notification on the national exit test. It said that the notification regarding the next is expected soon. It is a crucial decision that has been taken up by the government on the next. The exam is scheduled to be conducted in December next year. The matter is still under discussion. The National Board of Examination has released the indicative seat matrix for round 3 admissions to the DNB Post Diploma Courses 2022 admission session. According to the seat matrix, a total of 1,139 seats are available for the DNB Post Diploma candidates. The maximum number of seats are in the specialty of anesthesiology with 372, followed by orthopedics with 167 and pediatrics and radiodiagnosis with 166 seats each. Pulling up the state government on the lack of family medicine doctors in the state as well as the absence of a mandatory department of family medicine in all medical colleges, the Kerala High Court has directed the State Health Ministry to dispose of the matter in the next 2 months. Kerala High Court directed the Secretary, Ministry of Health and Family Welfare, to dispose of the plea filed by the Social Health One Health Movement Charitable Trust within 2 months in the matter of the creation of the mandatory department of family medicine in all medical colleges, filing of the post in family health centers only with doctors who have received specialized training in family medicine, that is MD, DNB, Diploma in family medicine, and to provide adequate in-service training to the doctors appointed in family health centers in Kerala in the field of family medicine.
For patients with solitary metastases from prostate cancer, an approach called metastasis-directed therapy or MDT can slow the time to cancer progression, reported a study in the Journal of Urology. MDT-focused treatment using surgery or radiation therapy without androgen deprivation therapy or ADT. Metastasis-directed treatment has emerged as a potential alternative for men with oligorecurrent prostate cancer, a state of disease with a limited number of metastatic lesions after initial treatment. In the MDT approach, surgery or radiation therapy is used to specifically target the area of cancer spread. That's in contrast to ADT, systemic therapy to block testosterone and other male sex hormones, which promotes the growth of prostate cancer. Androgen deprivation therapy with or without other systemic therapy is the standard treatment for metastatic prostate cancer, but has numerous adverse effects that can decrease quality of life, including sexual dysfunction, bone thinning, and loss of muscle strength, among others. If MDT is effective in controlling limited recurrences, it may avoid or delay the need of ADT. A new study from Washington University School of Medicine in St. Louis and the Veterans Affairs St. Louis healthcare system shows the health consequences of reinfection with SARS-CoV-2. The researchers found that repeat SARS-CoV-2 infections contribute significant additional risk of adverse health conditions in multiple organ systems. Such outcomes include hospitalization, disorders affecting the lungs, heart, brain, and the body's blood, musculoskeletal and gastrointestinal systems, and even death. Reinfection also contributes to diabetes, kidney disease, and mental health issues.
In 2021, about 6.2 million US adults aged 65 or older lived with dementia. Because age is the strongest risk factor for dementia, it has been predicted that increasing life expectancies will substantially increase the prevalence of Alzheimer's disease and related dementias from about 50 million to 150 million worldwide by 2050. The prevalence of dementia in the US is declining among people over the age of 65, dropping 3.7 percentage points from 2000 to 2016, according to a new RAND Corporation study. The findings are published in the latest edition of the journal Proceedings of National Academy of Sciences.
4 hours of light physical activity per week can now be linked to milder symptoms from intracerebral hemorrhage and also to better survival rates, a University of Gothenburg study shows. Intracerebral hemorrhage is the most serious type of stroke with few treatment options. About 1 in 10 cases of stroke is an intracerebral hemorrhage, a condition caused by bleeding with the brain tissue with high risk of death and disability. This is the first study that examines the relationship between physical activity, acute stroke symptoms, and death after intracerebral hemorrhage. The results show that light physical activity such as taking a walk or cycling for at least 35 minutes per day markedly reduces the likelihood of severe symptoms and death after intracerebral hemorrhage, the researchers said. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.